Hi, Jack.
Hello, how are you?
Oh, another fun day in COVID.
Aren't they all? Right, okay, I'll get things kicked off then. So I'll start by saying hello to everyone and welcome to tonight's webinar. My name is Jack Stacey and I'm part of the COVID communications team here at Birmingham City Council. The format for tonight's webinar will be the same as usual. Of course, we've got Dr. Justin Varney, who is the Director of Public Health for Birmingham, giving an update on the current situation in the city. He'll be touching on the hot topics of the moment, which are case rates, testing, the vaccine, and the hottest topic of them all, which is the government's changes to its Christmas bubble rules. So there's plenty to fill the rest of the hour. Once again, for the benefit of those who are perhaps joining for the first time, the format of proceedings will be that Justin will take us through his update, during which you'll be able to ask your questions. If you just click the chat icon that's in the middle of the screen there, that will bring up the chat box on the right hand side, and you'll be able to drop your questions straight in there. After Justin's update, he'll be able to go through all those questions and answer those as much as possible, given the time that we've got. If there's anything that's particularly lengthy or requires perhaps a researched answer, then we'll endeavour to get back to you through email. So if you just make sure that either the name that you joined with is either your full name, or if you just leave behind your email address and your full name as well, we'll get back to you that way. And yeah, I think that's pretty much it from me. I don't want to labour the introduction too much, because I know that we've got quite a lot to get through tonight, I imagine. And so I'll pass over to the man that you've come to see, which is Dr. Justin Varney.
Great, thanks, Jack, and good evening, everyone. So, where to start? So let me start with where we are at the moment. So the most recent data that's literally just been published this evening is the case rate up to the 16th of December. And that means that shows our case rates increased to 250.5 cases per 100,000 population. That's an increase in percentage change of about 24%. And we're gradually starting to see that increase in case rate change increase really since about the second week of December. So we are in an upwards trajectory at the moment. The highest proportion of cases are still in our 40 to 44-year-olds, but we also have a particularly high number in our over 90s age group, although that's a much smaller number of people. We're starting to see some very early signs of increased case rates in children, particularly 10 to 19, but it's still a lot lower. So just to put that in perspective, the case rate for 40 to 44-year-olds is 369 cases per 100,000, and for 10 to 14-year-olds it's 295, and for 15 to 19 it's 286. So still quite a lot of different distance between those early middle age groups and the children. And that's been the consistent pattern, I think, really we've seen over November, that this working age adult group is very much driving the case rates across the city. But we are seeing the early signs of an upwards trend in our over 60s over the last 3 to 4 days. And that is incredibly worrying, because that does correlate quite strongly onto the picture that we see in terms of hospitalizations. So that's why we get very focused on that case rate and that demographic. So I'll talk a little bit about testing, then I'll talk about vaccine, then I'll talk about the tiers and the bubbles. And I'll put the links in the moment, and then I'll talk about new variant. So testing, we're rolling out the lateral flow test. The lateral flow test is the test that same swab to back of your nose, back of your throat, but it goes into a little plastic cartridge trying to see if I've got my example one here for you. That's what it looks like. And you take the swab goes in the back of your nose, back of your throat, is then mixed with a liquid and drop it onto the kit. And then the kit has to be read within 30 minutes. So you have to go to a test site to do that. And the only test site we have currently in the city is at the National Indoor Arena. It's open from 8 till 6, and people can just walk up. They don't have to book an appointment. Lateral flow, there have been some discussions about how accurate it is, and I can see Julie's right on it asking that in the chat box. So what we're seeing at the moment is that lateral flow, there are 3 things that make it less accurate. So how you swab yourself, how that swab is then taken and mixed with the liquid and droppered, and then how it's read. So they're the 3 areas where it can reduce the accuracy. If all of those are done correctly, then it's about 80 to 90% accurate. However, if none of them are done correctly, it's only about 40 to 50% accurate. So in the National Arena, we've got a quality assurance process where we randomly get people to do a lateral flow test, and we send a version to the lab as well. And at the moment, we're getting match between the 2. So we're not seeing any significant mismatch. The lateral flow is most accurate at saying, are you infectious today? Because it needs a lot of the virus on the swab from your nose or your throat, because it's only going into that bit of kit. It's not going off to a fancy machine at a lab. So it's really looking, are you infectious today? It can be used in what we call cyclic testing, where people test every 3 days as a way of trying to pick up the virus, rather than just doing the PCR test, which is the one that goes to the lab. And we've got much more limited capacity for the lab test. So that's why we have the 2 different approaches. But lateral flow, very good for, are you infectious today? And we use it for people that don't have symptoms. If you've got symptoms, ring 119, go to the PCR testing site. There's a small number of people who get a false positive from lateral flow. And that's why if you do test positive with lateral flow, we do a confirmatory PCR. But again, there's a relatively small proportion of that. We are looking to open additional mobile units. They'll have a smaller capacity than the National Arena. And we're hoping to be able to give that information to you tomorrow. I can't give it to you today because we're just locking down the final bits of security for the sites, etc. But they're outside of the city centre, and there'll be smaller units. They'll be able to do probably about 150 to 200 people a day, and they will be booked appointments rather than walking up. So slightly different model for their units, but because they're much smaller, we haven't got the capacity to cope with massive queues like we do at the NIA. The NIA, when it's running at full capacity, can do about 600 to 700 people a day. So it's, there's a lot of capacity there at the moment. John asked about the schools and what's happening about schools and testing. So I'll touch a little bit on that before I go on to the vaccine. So government's working directly with secondary schools, with care homes and with universities on providing access to lateral flow testing for them. Schools have been offered, if they're secondary schools, the opportunity to take part. As I understand it, it's a voluntary opportunity, and head teachers are looking at it to try and understand what it means. The reason it's only secondary schools is because the children need to be able to swab themselves, and children under the age of 11 generally aren't able to do it themselves. They don't push the stick far enough. So I think that's the reason why the focus is primarily on secondary schools. And the proposal that the Department of Education has offered the schools is that they should be testing all children and all staff once a week. And if children are sent home as a bubble, parents have the option for the child to be tested every day and come to school, or to isolate at home for 10 days. So there's also a model in which that will be used around the bubbling. And there's a whole load of support that's potentially available to schools, which rolls out after Christmas, to help them to do that. But it is something that's being done directly with the Department for Education and schools rather than through the council. Similar approach with universities. 5 of our universities stood up testing sites to allow students to test before they went home. Very, very small proportion of positives, less than 1%. and those testing sites will be stood up again when students return. So I think that's where we will see things going. So I'll move on to vaccine just before I cover off the, oops, sorry, that's the Prime Minister talking in the background. Before I cover off the new variant a bit more. So where we are on vaccines rolling out, and that's being led through the NHS. So I'm not responsible for prioritisation. I'm not responsible for how it's being done. That is very much being led by the CCG. And we are working with them to do a specific session for champions in January on vaccination. So getting one of their experts in to talk to you about it in early January and talk you through the approach. At the moment, we still only have the Pfizer vaccine, which is the one that's very fragile and has to be kept super chilled. Think of it a bit like ice cream. If you take ice cream in and out the freezer, gets that nasty crystal taste to it and gritty flavour. That's the same thing that happens to the vaccine. Each time it's defrosted, it crystallizes. So that limits what you can do with it and how far you can move it around. We know there have been issues rolling it out over the weekend with long queues at some practices. In general, the feedback I've had from those practices is that that's because patients turned up, in some cases, 3 to 4 hours before their appointment. And of course, there isn't space in the practice for them to sit. So that's created big queues. So they are trying to encourage the messaging to say to people, only turn up just before your appointment. Please do not come to the vaccination site an hour early. It really doesn't help us. And ultimately, you could end up standing in the rain. Because sadly, that's what we did see over the weekend. And so the NHS will be reinforcing its messaging on that. So now I'll just talk about the new variant before I come on to some of the questions in the chat box. So viruses change all the time. And each time they change, it's called a variant. And usually they change a little bit. Sometimes they change a lot. This new variant that appeared in Kent probably about 2 months ago now, has a lot of small changes, but ultimately still COVID. Our bodies still recognise it. From what we've seen so far, vaccine still works. The test to detect it still works. So there aren't any concerns at the moment about those things. The new variant is more infectious than the previous version. And what we're seeing is that it's more infectious for 2 reasons. One, people who have it have a lot more of it, and that's called a viral load. So there's a lot more virus circulating their body. So on their swabs, it's absolutely teeming with virus, which means that when they cough or speak or shout, those droplets that come from their mouth are like packed with virus. And therefore, if they land on someone else, they are much more likely to infect them than someone who's got the old version, where there might be only 3 or 4 in each droplet. This droplet's got like 100 in them. So there's that viral load factor. The other thing that's changed is that one of the variations has made the surface of the virus more sticky. And this means that basically when the virus lands on your mouth, up your nose or in your eyes, and it tries to bond with a cell, because that's how viruses infect us, is they latch onto a cell and they kind of inject themselves into the cell, and that's how they then reproduce using the cell's organs, is that this new variant, it lands and it sticks 90% of the time, whereas the old version only stuck 50% of the time. It's much, much more sticky. So those two lead to why we say it's more infectious, more transmissible, and 70% more infectious than the current version. We are seeing that this variant is has spread in more children than the previous version, but there's no difference in terms of how sick it makes people or how many people end up in hospital. So the risk about it spreading more in children is that then children will spread it to families more, rather than any more risk to them. Obviously, if more people have the virus and it's the same proportion that get sick and die, then overall we will see more pressure on the NHS over the coming weeks. So that's why we'll see, I expect, more areas going into more severe tiers and restrictions over the coming days and weeks. And I expect there will be some announcements, is why I'm keeping one eye a little bit on my phone to just check what the Prime Minister is saying at the moment in terms of issues, although I think he's primarily talking about the transmission and the travel to Europe at the moment and what it's going to do to travel. So I'll move on now to take a little bit of the questions from the chat, if that makes sense. So Fiona asked about criteria about tipping us from tier 3 into tier 4. I think there are two things at the moment that are important in people's, the national decisions. So one is our rate of increase. So there are areas of London at the moment that are increasing by 100 to 120% every 7 days. So they're basically doubling. We're increasing by 20–25%. Now, if we stay increasing by 20–25%, then that's not great, but it's not enough to push us into tier 4. If that suddenly becomes 50 or 75% increase, then we will be going into tier 4, because that rapid increase is what signals that the new variant is here, because it's their very rapid spread. So that's probably the thing I'm looking at most at the moment, is the percentage change in the case rate. And I'm obviously looking at the numbers every day, because again, what I'm really looking out for is if we see a sudden increase in cases, that will start the alarm bells that the new variant is here. And we will want to go into restrictions faster to protect people and save lives. But I do also expect that if you look across the country, the general upward trend is upwards, and National Silver is meeting tomorrow, National Gold is Wednesday. I strongly suspect there will be an announcement either Wednesday, probably Wednesday night, about further areas going to restriction, if not a national restriction starting on Boxing Day. But we'll see. I mean, that's just me crystal ball gazing. I don't have any secret links in to government, but I think if you look at the numbers, that they are not going the right direction, and this new variant makes that even more worrying. Jane asked about flexibility of the day to form your Christmas bubble. I asked this today explicitly from government. There is no flexibility. The only day you can form a Christmas bubble is on Christmas Day itself. I'm sorry if you're an essential worker, you're working on Christmas Day, there is no flexibility on this. I did put the question up earlier this morning, so I'm sorry, Jane. Having worked many Christmases in the NHS, I absolutely understand. But I also understand from government's perspective, that we can't have a world in which people, some people are bubbling on Thursday, Christmas Eve, some on Christmas Day, some on Boxing Day, some on the day after. The very reality that we're still getting one day to form a bubble, I think is pushing it, given the amount of risk we have at the moment. Kate Ray asked around the case rates for children. I did put the link in the chat for you. If you look at the government website, you can pull them off for yourself, but the latest case rate for so I get the mouse across, 16th of December was 295 cases per 100,000 for 10 to 14-year-olds, and 286 for 15 to 19-year-olds, and 121 for 5 to 9s. And to compare that for 40 to 44-year-olds, they are currently running at 369. So there you can see there's quite a big difference there. So Paula asked about, can you test positive after your infectious period? How long will it last? And what about lateral flow? So if you have had a positive test for COVID, you are asked not to retest for at least 6 weeks, because it will still be positive. Particularly the PCR test, because that finds every little fragment of the virus. But the advice is you don't need to retest. If you've had a positive test, don't retest for 6 weeks, because it won't change. And that's why. And that's the same for lateral flow or PCR, basically. If you've had a positive test, it's on average about a 6 week period. Carol asked about if you've had COVID, does it prevent transmission? We don't know, is the honest answer, Carol. I think there are a couple of things to keep in mind. One, we know that about a third of people who catch COVID don't develop antibodies. Of the 2/3 that do, a third of those forget how to make them, or they don't make them properly, or they just don't work at all. So actually, there's only a relatively small proportion of people who catch COVID and really mount a defense to them. And what we're not seeing is any evidence that if you do have antibodies from natural infection, that it stops you spreading it. So one of the things that the vaccination often does is it teaches your body to be super aggressive when it's defending yourself against a virus. And that means if the virus lands on you, it's got nowhere to stay. It basically gets brushed off quickly. If it gets into your mouth, your body attacks it and kills it, which means that the chance of you passing it on is very low. But we only really see that kind of protection coming from vaccination, not from natural infection. Okay, so Carol asked, if someone who's got no symptoms tests positive, how many days going back are their contacts deemed at risk? Is it 48 hours like it is for symptoms, people who've got symptoms? Yes, so what we do is we look at, in the contact tracing, where have you been for the last, I think it's 7 days, it might be 14 days, they keep changing it on the system. Where have you been in terms of looking at places you might have been with other people, might have been exposed. But in terms of people who are considered contacts, it's the 2 days before the day you took the test. So if you tested positive on Friday, we look at anyone you've been in contact with for less than 1 meter's space for any length of time, or less than 2 meters for 10 to 15 minutes on the Thursday and the Wednesday. So the day you have the test doesn't count, it's the 2 days before that. Wasim asked, if staff do not consent for serial testing but are self-isolating because they have symptoms or not, can the school ask them to take a test? I don't think in any of the guidance I've seen from the DfE that anyone's forced to take a test. So if someone is choosing not to test, then I don't think they can be forced to, but I'm not sure yet whether that means that they can't do their job or not. And I think that's one of the bits that the trade unions and the Department for Education have got to work through. Jason asked, do you have to live in Birmingham to be able to access the lateral flow? So what we've said is that you need to either live in Birmingham or work in Birmingham. So when you turn up at the site, you need to have proof of address where you live, or you need to have proof of where you work. So if you live in Walsall but you work at the mailbox, you should have something from your company that shows you work there, whether it's a pay slip or something else. Because there are testing sites in other parts of the country. I think there are now 4 in North Warwickshire, Coventry's got 3, Solihull's got 3. You know, they are dotted around the place. Obviously the NIA, I think, is the largest one in the region. You're also asked, coming to the NIA, please only bring small bags, and please bring a photo ID as well. And that's to do with the security around the NIA rather than the test itself. And bring a smartphone, because you need to be able to register for the test, and they need to be able to text you the result. And that's just to do with it at the moment. John asked about DfE says the 4th can be an extra inset day. I think that's true, John, but I have to say, education questions, please, if you're a school, ask the education team through the School and Governor Support Helpline, because they're much more well versed on what the department is said. Beck gave some feedback, positive feedback on the arena. Really great, thanks for that, Beck. I have to say, I've now had 2 tests through the arena. One to do a video for staff when we were opening it, and another one at the weekend. And I have to say, I think it's a very good facility. It's great. You might have to wait a little bit. The thing that slows it down is the registration. So if you are going to have repeat testing because you work in a close contact job, say like you're a taxi driver, or you work in a kitchen, then it's worth the first time spending the extra couple of minutes to do the NHS registration, because once you've done that, when you go back again, it's faster. But it's pretty slick procedure. So Benita asked about someone's been told by a doctor that not suitable to have it because they've got a penicillin allergy. I'm not seeing penicillin allergy included in the reasons not to have it, but people who have very, very severe allergic reactions are excluded at the moment from the Pfizer one. So it depends a bit on what their allergy is. So some people have a penicillin allergy, have to carry the adrenaline pen with them, that kind of full anaphylaxis. They wouldn't have it, this version of the vaccine. If they get an upset stomach and a mild reaction, then they might be okay. But it is being made, the decision's being made by their GP, not by random doctors. So the important bit is if someone's just been told by a friend of a friend whose aunt's sister is a doctor, ignore it. Their doctor needs to make the decision based on their health history. We seem to ask about the NIA and can we use it to help train staff? Yeah, we are looking at that model at the moment, actually, about once schools start to understand and have worked out how they want to do this. The same for our workplace spokes. We are looking at, can we offer training so people who are going to be running testing on site can come in and spend a day at the hub working alongside our teams and get used to it as well. Susan said, is anyone monitoring infections after the vaccine? Yes, they are. So two things. People are kept at the vaccination site for 15 minutes after the vaccine is given. And that's to make sure that people don't have an acute reaction to the vaccine. And then they're also given a card that if they get any other side effects, then they can ring that up, and that's captured nationally to keep an eye on it. The process itself is very safe. This is no different from the process we use in the flu vaccine. I don't think there's any reason why people can't drive themselves, but keep in mind that at the moment they're only vaccinating the over 80s. There's no restriction on NHS staff or care home staff, for example, driving to be vaccinated. There, actually, these are people who are currently not got any symptoms because they're told not to attend if they've got any symptoms. So the risk of a queue is low, and the nurses and the healthcare staff are wearing PPE when they're delivering the vaccine. So, I think actually this is very safe the way it's being done. And it's very important people don't get scared and don't listen to half-truths in terms of this, because the NHS is trying to make sure that we do this in a way that protects people, keeps them very safe. And that's why it's really important people only go when they've got their appointment, because it allows them to manage the queues and the risks around that. So Andrew asked about what advice can I give to people who don't want to be tested or vaccinated? So first of all, let's talk about testing. If you don't get a test and you've got COVID, you will infect the people you care about most. That black and white. Trying to prevent the spread of this inside houses is really hard. There are things you can do that help, like staggering meal times, washing your hands, those kind of things. But the reality is that you cannot, once it's got into a house, it will spread. And if you don't know it's spreading, you're going to put everyone in that house at risk. So I don't understand why people don't want to get a test. There's a whole load of rubbish out there where people go, oh, there's a chip on the end of the stick. Frankly, if there was a chip, we were able to insert a chip on the end of a little plastic bit that looks like this and get it into your body and then be able to pick up a radio signal from it, we would have solved cancer by now. It's just not possible. So, the reality is you are most likely to catch COVID and give COVID to someone you know well, because they're the people you don't keep the distance from. In terms of vaccination, again, it's very difficult to challenge the people that are anti-vaxxers and make them see sense. But the vaccine's been well tested. It is the best shot we've got at getting back to a normal life. And if many people choose not to have it, then the simple answer is we just stay in lockdown for longer, and people will lose their jobs and their livelihoods. That is the reality of the situation. More people will die unnecessarily because people make stupid decisions not to get a vaccine. And sorry to put it that bluntly, but I really struggle at the moment when I see the number of people that are still dying from COVID, the number of people going into hospital, the number of cases that are happening every day. And I get people who kind of read third-hand information and go, oh, I'm not going to get a vaccine. Well, it is irresponsible at the moment. Beck asked about when the tiers being considered. I mean, my hunch is that we will get some announcements this week after Wednesday's National Gold meeting, but officially the tiers aren't due to be reconsidered till the 30th of December. Centrala asked around a question about self-isolation. Parents receive some notification from school there's been a case in the classroom. Does the parent need to isolate as well as the child? No. Isolation is only for the child. Parent can go about their business, but you can't take the child with you. So isolation means child stays at home, not child goes into the back of the car while you take another child to school, not child goes with you to supermarket. Child has to stay at home. So isolation means stay at home. Reg and Sue asked about shelf life of the vaccine and how long it's kept. My understanding is it has to be used the same day once it's broken down. So it's defrosted and then it's split up into smaller bottles. So it's actually relatively narrow window. Joy asked, is it effective, the vaccine? Yes, as far as we know, it is effective for the new variant. Paul asked, good question, is there a good time to get a PCR test after the onset of symptoms? Basically, sooner the better. There's not, for people who've got symptoms, if you can get it within the next 24, 48 hours, that's great. The sooner you get it, the sooner you'll know it's COVID or not. But after about 7 days of symptoms, it's probably not so good. But really, it doesn't have to be the same day. So at the moment, there's no evidence that the new variant's in our area, but I don't expect it will be long. Adrian asked about care homes and care home testing and providing lateral flow for visitors and PCR testing and extra funding. So my understanding is that's all being sorted through government. I'm afraid I don't get involved in that kind of thing. But there is, and my understanding is there is extra money coming to everyone who's doing testing, basically, whether it's care homes, universities, schools, the council, there is money for that. Diane asked, are you infectious during the 6 weeks after your first positive test? No. We think you are most infectious, well, we think you're infectious for about 10 days after you become symptomatic. And after about 10 days, most people's symptoms have either resolved, or they've got a lot worse and they're in hospital, or they've just got the lingering cough, for example, but the temperature's come down. And all of that means the virus in their body is now much lower levels and they're much less likely to spread it. So that's why we have the 10-day isolation for people who are positive, because it's unlikely, it's unusual for them still to be infectious after 10 days. Magda asked, are there any people who are completely immune to COVID who haven't had it? Not that I've seen any evidence of, I'm afraid. I don't see anyone who's got natural immunity. There's some evidence that there are some people who find it harder to catch it, but there's nothing really concrete on it, I'm afraid. Adrian asked about there's some rumours about women of childbearing age saying they won't take the vaccine because of perceived risk and lack of testing in pregnancies. So I have to say, last night I saw a GP colleague who's pregnant had posted that she's just had the vaccine. And if I'd expect anyone to be really on top of that, it would be a GP. But the reality is We can't test every single eventuality, but this technology of vaccine is, is stuff that we know and we have done before, the vast majority of it. So the risk of it to pregnancy is very low. But I think at the moment, the Pfizer one, it not given to women at the end of pregnancy. There is some specific guidance about pregnancy and the Pfizer one. As the other variants the other vaccines come out, I think it'll get a lot easier actually, because they're much more commonly used technologies, and therefore we know very well about how that plays out. Someone said if they've had the COVID, the normal COVID-19, can they catch the new variant? We think so. We've certainly seen examples of reinfection in London where the new variant is more common. So I don't think, as I said before, I think if you had COVID once, you can definitely catch it twice. So it doesn't mean anything different. In terms of, Penny asked about advice on posters that we can print out. Penny, if you drop Jack a private message in the chat with your email, we can follow up with you. There is printable stuff that's on the council website in different languages as well. Magda asked about if people are allowed to use public transport, work in factories and go to schools, what's the point of banning Christmas gatherings? Well, shorthand is, who's monitoring your social distancing while you're passing around the Christmas carp, which I think is the traditional one in Poland, or ham or turkey? That's the difference. In a workplace or in a school, someone else is managing the COVID safety. In the privacy of your own home, it's not being managed. And we know that the majority of spread is happening and still happening between people going in and out of each other's houses. So, and I think as Anne raises the point, given that risk, think very, very carefully about how you approach the Christmas bubble for Christmas Day. Do you want this Christmas or do you want the next 10? That, we're all going to make our own individual choices. Personally, I can no longer see my parents because they're in London, they're in tier 4, so you can't go there. And although Magda, I wouldn't say it was Ebola, actually, if you treat everyone like they're infectious, then you'll probably behave much more sensibly about it all. Deborah asked about vaccination priority in early years. The reality is that actually the biggest risk of people dying from COVID is in the over 80s, then the over 70s, then the over 60s. That's why it's being done in age priority. The risk of children under 5 dying is very, very, very low. So I can't see any point actually to vaccinating early years providers any earlier, or giving them any priority over care home staff, for example. Should people be more aware about lateral flow and the implications of negative? Yes, and we've been producing some leaflets actually at the site, which I think should be going there this week, so that people do get a leaflet that explains what a negative test means for lateral flow, because I think people haven't quite got the head around it yet. Great to hear Benita giving positive feedback on Magda for the briefing she did on Erdington Champions, which is really great. COVID marshals outside of the city centre. So there are COVID marshals in other parts of the city. They're not just in the city centre. The council's worked with all of the business improvement districts, and where there aren't business improvement districts, they've worked with other providers to put COVID marshals in. So they should be out and about on all of our high streets, really. They won't be in areas where there aren't lots of shops because that's not their primary function. We've also been using COVID marshals actually with schools over the last week or so before schools broke up. So there's been a pilot with, I think it was 8 schools, where COVID marshals popped by at the time that kids were being picked up from school. And one of the head teachers wrote to share actually how incredibly positive parents found that and how it really improved behaviour at the school gate. So we're certainly looking about that at the moment before whether we can roll out more of that. Deborah said, if you're pregnant or planning to become pregnant, people are saying they won't have the vaccine. you know, I don't see any evidence from any of the vaccines we've used in recent history of implications for pregnancy. These are not live vaccines in that they don't have the live virus in them. So I don't think there is a significant risk to pregnant women. There's certainly no risk to fertility. There is a very, very real and present risk from COVID. So, you know, you can, is that balancing act between the risk you know, which is reasonable from COVID, and if you're of childbearing age, is still reasonable. You'll either catch it and become quite unwell, or you'll give it to someone you love who will become very unwell. Or a risk which everything we know so far says will be minutely small from a vaccine that will stop you giving it to someone else. So we'll see. Julia said, will everyone be vaccinated eventually? I don't know. I mean, certainly the original plan was to vaccinate everyone. I think given the pressure at the moment will be priority is given, and if we can get all of the most vulnerable people vaccinated by the summer, then actually most of the restrictions can be relaxed, because if we can mean that the majority of people who get this don't need hospital, don't die, and the people who are at risk of that are protected, then we may be able to see much more relaxation without everyone needing vaccine. But ultimately, to get this under control properly, we need kind of above 80% of the population to be vaccinated. Elizabeth said, have I got advice for people going to church on Christmas Day? Keep your distance, keep your distance, keep your distance. I think that's really important. You know, if you're going to church on Christmas Day, no exchanging gifts with people you don't live with, no shaking hands, no passing the peace. You know, keep your distance, wear a face covering, wash your hands as your hand sanitizer, avoid touching anything that anyone else has touched as much as possible. You know, there is no evidence of transmission in congregational settings. That's why they're still allowed in Tier 4, but there is always that risk. And I would really rather Birmingham didn't become the case study that disproved it. Yeah, so Deborah's explained a bit more about, the question was around adults working with children who then are in a support bubble with their older mothers, for example, older parents. Yeah, I mean, that's going to be true for anyone, frankly. And I think at the moment, what we're not seeing is that we've got to prioritise the vaccine to protect the people that are most at risk. So actually the prioritisation will work in that situation, because the 75-year-old mother should be offered the vaccine in the next priority group. And once the mother is vaccinated, then they are protected from whatever the child carer comes into contact with. So the protection comes from mum being vaccinated first, who's the oldest member of the household, rather than anyone else. Yeah, so Aberdeenshire says they've got an office in a Tier 3 area where people are scared of vaccine because of the rubbish on social media. Yeah, I know, and it's really challenging. And ultimately, the balancing act we've got is that we know that the more you argue with the small number of people who've got very, very distorted views on vaccine, the louder they get, but they never change their views. And actually what's more important is to put out the truth, to put out the science, because the group in the middle are the people who get confused and can be swayed. You know, if you try and pick a fight, it doesn't persuade them. If you just keep going with, look, this is why we're in the situation we're in. You know, the vaccine has come quickly because we've thrown loads of money at it. We've turned every traffic light in the system green to make it move faster, and we've been doing research in parallel at multiple countries. This is not some secret conspiracy that was invented down the back of a sofa. This is because globally, this is the most serious threat to the health of the world since the World Wars. And that's why every buck has been pulled out. We have done everything to make this work and make it safe. There is no step in the safety journey for the vaccine that has been missed. So I'm very confident the vaccine is safe, but I also think there's a point at which there's no point trying to argue with people who view the world in a very distorted way. and they will make their own choices. And we can't, unfortunately, given the world of social media and the internet, you can't shut them down. They've got freedom of speech, but I do slightly view it as people who wear tinfoil hat space, I'm afraid. And sorry to be blunt, you can tell it's been a long day, I'm afraid, today. Point about schools. Julia was asking about schools and mask compliance, and pupils wear their mask when they get on the bus and then they pull it off as soon as it's pulled away. I think the challenge here is helping young people to understand why it's important. And I think we are looking at how can we do more with young people, so that it's peer-to-peer education. We're looking at, could we develop quite quickly a young people's COVID champion group, so that they get this type of session with me and the team, but asking their questions, so they can then go back and share that with their own age group, to try and help support that as well. So we are thinking about that. Magda shares her experience. Yeah, I think for many of us, I was really, like everyone else, I really, really want to see my parents. My mum's just come out of hospital, and it's really hard, the fact that I can't see her, but it's safer for her and for my dad, and it's not worth breaking the rules about and putting them at risk. So it is what it is, I'm afraid. Fiona asked, when do I think we'll get foreign travel back? I think, as I've said before, I wouldn't book your cruise of a lifetime until at least the autumn. I think, it's going to be a while. But I think the travel restrictions we're under at the moment have just come into effect in the last 24 hours, are probably only going to last a little while, because there is already evidence that this virus the variant is already in Europe. So that once it's already in Europe, there's no point. Okay. So just some comments around the tier 4. Is the risk reduced if you meet family outside? Yes, it is. But you still have to abide by the rules, and the rule of 6 applies while we're in tier 3, and you can't do that in a private garden. So it's, but going for a walk, go for the Christmas Day walk, Boxing Day walk, that will help reduce the risk. The key thing, if you are meeting indoors, is get the windows open, really air the room out before people come into the room, and then the moment they leave, air it out again. That will disrupt the droplets, it will help get them out of the room, and that's really important. Penny asked about, is the vaccine safe for asthmatics? Yes, there's no exclusion for vaccine at the moment. Okay. Yes, I said Christmas Day has now become the kind of popular date for marriage because of the bubble window. What would I say to families on this? Think very carefully. Really, really, really carefully. That's the reality of it. Particularly any elderly or vulnerable people, it's really important about keeping the social distance. At a wedding, everyone other than the bride and groom have to wear face coverings. All of those things will reduce the risk, but it is a risk. Deborah says her mum isn't able to have the vaccine for some reason. There are, I'm afraid, always going to be cases that don't fit, but I'm afraid nationally it's a national policy on prioritisation, and it is a one-size-fits-all, and it has to be. Having worked in national government, these are really difficult decisions, but you have to make the decisions, and you can't have a policy where, can we have an exemption of this, can we have an exemption for that? It just doesn't work with that. I'm afraid. So, it is what it is. And those decisions are made nationally by the NHS. It's not something the council has any role or influence on. Fiona says, is testing going according to plan? I've heard of people in another area who are overrating, being told instead of being called to be vaccinated, they won't be called until, so it's a question about vaccination. So the rollout plan for vaccination is, I would say, kind of slow and steady. One of the issues we've got is the vaccine supply. So what's coming from the national distribution down to the hospital and to the hubs. And people are being called when we know they've got the vaccine and not being called if it hasn't arrived. So there are people that, you know, other parts of the country, it's arriving different amounts at different times. So it's going to be really, really difficult, I'm afraid. It's not, I wish I could say there's loads of vaccine and it's all over the place. It just isn't. That's not the reality of the situation. So Anne says, much like COVID marshals, do I think government will give local people enforcement powers to curb people not doing what they should? I don't think so. There was quite a lot of discussion about this, Ante, when COVID champions came through, COVID marshals came through, about would they have enforcement powers, and at the moment that wasn't taken forward. So yeah, it was. I'd be surprised. What I think we probably will see is a lot more COVID marshals. And I'm really keen. I've been talking to the team that lead on this about the opportunity to use some of the funding to support schools to employ COVID marshals. In the same way we're giving money to the bids to employ them. So we'll see how that plays out. Juliet said about the Youth City Board. Yeah, Juliet, I think my team are already talking with you and starting to link through, and also with Darnish as well, so joining the dots there. Question from John about average time from PCR to test results. Okay. At the moment, PCR is, we're getting the results back in usually within 2 days. Small number of tests are taking longer, but at the moment the average are coming through in about 2 days. So today I saw a couple of cases linked to schools come through. And I was on call over the weekend, which is probably why I'm a little bit more tired and blunt than I would normally be. And we saw some cases linked to schools over the weekend. But I would hope that by close of play tomorrow, Wednesday morning at the earliest, we've got the vast majority of children who were symptomatic on Saturday or on Sunday tested and got a result. Because ultimately, if they become symptomatic on Monday, that doesn't impact on the school because the 2 days they weren't in school. But it's really the any children who develop symptoms over Saturday or Sunday, that's going to have an impact for the school and their children in their bubble. So my hope is that by Wednesday we'll be through that, but the labs do seem to be going okay at the moment. Carol asked, is it good to wear face coverings outside as well as inside? I have to say, it doesn't massively change the COVID risk outside, but the value in keeping your face covering on is you tend not to contaminate your hands with anything that's on the outside. So the more you take it on and off, the more you're just getting gunk on your hands, and the more also you're touching your face. So the important bit is if you are taking it on and off, hand sanitizer before you take it off, and hand sanitizer before you put it back on. Because when you put it back on, because you're using your hands on your face to put the ear loops on, to get it right in the right shape, all of that, everything that's on your hands is touching your face while you're fiddling with a mask. So if you can find a comfortable one, much, much better to get it on before you leave the house and just keep it on until you come back in. And I'm seeing a lot more people do that, actually. What I really dislike is wearing it as a chin strap. Partially because what people tend to do, I haven't got one with me actually, but when you wear a face mask, just seeing if I've got one in my bag by me, haven't, okay. When you wear a face mask as a chin wrap, what happens is that the mask goes down, and what it tends to do is turn on itself. So everything that's on the outside then gets smeared up towards your mouth over your chin. So that's why it's just not helpful. So my advice is put it on, keep it on, and take it off when you get home if you can. And if you do take it on and off, hand sanitize before you put it back on. Keep the germs off your face. Paula asked about time frame for the remaining 2 vaccines. Well, actually 3, so there's Sputnik, Moderna, and AstraZeneca, Oxford. AstraZeneca and Oxford, I think we're expecting probably first week of January. I'm not sure about Moderna. I'm surprised it's not been approved yet because it's moving forward well in the States. So I don't know quite why Moderna's not been approved here yet. We haven't bought a lot of Moderna, so that might be why, but I would expect that Moderna will come through probably in the next week or 2, and then Oxford pretty quickly afterwards. Penny offered some help from Hope Radio. Penny, do drop a line to Jack and the team. You know, we can help get some messages out to you. I think it's really helpful. So Ante said, is there any way to identify anyone who'd had the COVID vaccine? Not at the moment. So it's not like we're giving COVID badges when you've had it, because you've got to have 2 doses before you're protected, and no one's who hasn't been in the trial has had the 2 doses yet, because we only started vaccinating about a week or 2 ago, and you've got to wait a month till the next dose. So no one's fully protected yet, but I think we probably will start to see perhaps in the new year something which goes onto people's medical records to say they've had the 2 doses. Because you've got to have 1 dose and then the 2nd dose a month later. You can't have them both together. So I hope that we will, I think we probably will start to see that in a little while, particularly as more age groups get it, because once you've had both doses, basically you're protected. So then it allows people to have a bit more freedom. And the irony, of course, will be, it will be the most elderly who suddenly are able to go out and do all the things that so many of us want to do. So I think that's probably where we're heading. And yeah, so Mohammed, as I said, it's 2 doses for all the vaccines are 2 doses a month apart. So you get 1st dose and 2nd dose a month later. So I think, Jack, I'll probably end there. We've covered all of the questions. I have no idea how many we've covered today, but it feels like it's been a lot. We'll try and get a bit more information from the NHS for you about the vaccine and pregnancy, because I think that came out as a clear thing that people wanted a bit more info on. And thank you for all the kind words from everyone. I appreciate it. And I think Julie's lovely image to leave us with about Broad Street full of the over 80s taking advantage of Coyote Ugly, I think is a lovely image to end today on. So I'll pass you back to Jack now. Have a lovely Christmas, however you're celebrating this year. Stay safe, and I will see you in 2021.
Thank you very much, Justin. I think everyone will agree with me when I say you make it look massively easy to just run through all of that information there. Yeah, so I suppose we'll just sign off by saying that, as always, if you have any questions or anything that needs clarifying, then please just get in touch through the COVID Champions email address, the usual one. The next webinar won't be until next year, so you'll be receiving the invitation for that pretty soon. But other than that, yeah, I think it's time to wish you all a happy and safe Christmas, and we'll be catching up with you in the new year. Thank you very much.